Hello everyone and welcome. My name's Deb Pike. I'm the Manager of Special Projects at Volunteer Canada. I'd like to thank you all for joining us today for Volunteer Canada's webinar, Sitting Between Inclusion and Safety, a roundtable on navigating the challenges of re-engaging volunteers while the pandemic continues. Just a few admin notes before we get started. If you've not already done so, please ensure that your audio is on mute to reduce the background noise for everyone during the session. This webinar is being recorded, except for the discussion groups and the breakout rooms. The recording will be sent to all of the webinar registrants next week, and as well, we will post it on Volunteer Canada's website. We invite you to make use of the chat box as we go along for any questions and any comments. Let's start by having you use the chat box to introduce yourself, share your name and your organization or affiliation so that we can have a sense of who's in the room today. And with that, I'm going to hand it over to, I'd like to introduce you to Paula Spivak, who is the President and CEO of Volunteer Canada. And she'll be leading our session today. Over to you, Paula.
Yep.
Going to
apologies
to everyone for that little bit of technical troubles with Zoom. I think we're all getting used to the fact that there are sometimes some technical difficulties with especially with audio on Zoom. So again, I'd like to welcome you all to our session today. We're going to start off with just a bit of background and context for you, and then move into some group discussions so that we can really make use of everybody who's in the room to be able to share your experiences and challenges and issues as we navigate re-engaging volunteers in this challenging context. So again, as we started in the beginning, we'll take this time as we're getting set up to please use the chat and share your organization and your name, your organization, and your affiliation to see who's in the room. For those of you who don't know us at Volunteer Canada, our vision is to have involved Canadians, resilient communities, and in the end, a vibrant Canada. We work to provide national leadership and expertise on volunteering to enhance the participation, the quality, and the diversity of volunteer experiences with a goal of building strong and connected communities. We don't do this work alone. We work with more than 200 volunteer centers, with businesses, with educational institutions, with government departments, and with volunteers. Paula, I'm going to get you to check and see if we can hear your audio.
Hello there. How is that?
There we go. That's better.
Oh, excellent. Excellent. So one of the things that we want to come back to is basics, because when we look at issues related to our responsibility as organizations, we know that we're responsible for the health and safety of all those that we engage, whether they're clients, members, participants, volunteers. And at the same time, organizations are responsible for the health and safety of those that they engage in their work. Again, employees, paid, students, volunteers. And so with that in mind, organizations do need to adhere to all kinds of legislation related to employment and engaging people, whether it's human rights or occupational health and safety. Over to you, Deb.
Great, thanks, Paula. Within this context of the pandemic, we know that it has affected every aspect of our lives, our work lives, our personal lives, and for those of us working in the nonprofit sector, all of the work that we do and how we do it. And over the past 5 months, there have been several surveys that have taken a look at what are the impacts that organizations are feeling from the pandemic as we move now into October from a pandemic that hit us in the month of March. So we have seen through several surveys that the sector as a whole is threatened by the cumulative effects of this pandemic, of decreased revenues, of physical distancing and government regulations and restrictions, of job losses and organizational pressures. Those come with some organizations who have increased demand for their services and others who have decreased demand for their services. Within this context, Volunteer Canada had a survey in the field at the end of May, beginning of June, and we looked at what is the impact on volunteer engagement specifically during this time. And we know that a large percentage there was a decline in the number of volunteers for a number of reasons. We had organizations whose programs and services were postponed or canceled, and a large number of volunteers who stepped away from active volunteering for a number of reasons, whether those be health or age vulnerabilities or other responsibilities that they had at the time. Organizations, though, were working hard to be able to keep those volunteers engaged at the time when they had to step back, understanding and hearing from volunteers that they definitely intended to return when it was safe to do so. All the while that organizations were dealing with all of the pressures of the pandemic, as we continue to do, trying to operate within very changing environments, planning for continuity planning within the businesses, trying to decide if the changes that you're making during these times can or should or will be maintained, planning for a second wave, which it seems that we are into at the moment. And then for our topic today, how do we plan for safely re-engaging the volunteers who've had to step away from our programs and services as we get ready to reopen in-person active volunteering if we haven't already done so? As I mentioned in our survey at the beginning of June, when we asked volunteers who had to step away or chose to step away from volunteering what their intentions were in terms of being able to return to volunteering, organizations were concerned if their volunteers stepped away, would they come back? Overwhelmingly, over 80% indicated that yes, as long as they were comfortable with health and safety practices that were in place, they definitely intended to return to active volunteering. At the same time, we asked organizations, remember, at the beginning of June, where are you in your next steps for your operations? And at that time, almost 60% were actively planning their next step, and 18% already had plans in place for their operations and thinking about re-engaging their volunteers. Now, we have just put a second survey into the field, a follow-up survey to our survey in June, and we're looking at where are organizations today at the beginning of October versus where we were at the beginning of June, and what are organizations thinking about as they look forward to the next 6 to 12 months. So at this point, I'm going to get you guys to answer a quick poll for us. One of the questions that we're asking related to re-engaging volunteers is, what stage are you at in your organization related to re-engaging or planning to re-engage in-person volunteers? So you should see a poll up on your screen, and if you could take a minute to just click the answer that most reflects where you are within your organization, whether you did not stop in-person volunteering, whether you have had some programs suspended but you're planning to reopen, if you had suspended but you've already begun to re-engage in-person volunteers. There are organizations who are not, reopening is not in their plans for the foreseeable future, or it may be that you're just unsure at this time. So if you could take a minute to click that in, let's see your good sample size today. We'll see where you are. This was one of the questions, as I said, that we're asking organizations on our new survey. Allison, let me know when you have those poll results. We'll give people another minute.
All right, we're going to close the polling in 5 seconds.
Excellent. So we had a small percentage who have not stopped in-person volunteering, have continued all the way along. About 16% have begun plans to reopen. 61% have already begun to re-engage in-person volunteers, and 13% not in the foreseeable future, and a few who are unsure at this stage, which is completely understandable given the environment that we find ourselves in. Okay, excellent. I'll just let you know, I did take a quick peek at our survey this morning, and your responses are aligning quite well with what we're seeing across the field from organizations. The largest percentage of organizations were in the same boat as you find yourselves in on the webinar today, of beginning to re-engage in-person volunteers. And of course, with all of these different stages come all the questions that we have. Health and safety is priority number one for all of us. Within all of the operations, and especially within the circumstance of thinking of how we re-engage our volunteers safely. So with these questions in mind, I'm going to hand it back over to Paula to walk us through some discussion around these topics today.
Excellent. So one of the things we wanted to discuss, that's just coming up there, is to get your experience. This is a common question that has come to us, but we thought it was a good question as a springboard for your group discussions when you are put into breakout rooms. If older adults or other vulnerable populations are more vulnerable in the pandemic, should we exclude volunteers over a certain age? And that is a question that many are struggling with. Is this ageist? Is this something that is the right thing to do? And is it a bona fide requirement of the position? What would it be considered under human rights legislation? Yet what is the direction of public health? And when you think about older adults and autonomy and integrity and respect, do we want to take away the decision making of older adults who may want to make informed decisions? So I think there's a lot of dilemmas that we're being faced with. And so we thought that was a good question as a springboard for your discussions to share whether these are things that you're dealing with and other things related to that. So you'll be put into, we're over 70 today in our session, so you'll be put into small groups so that you could have a chance to really discuss this.
Okay, welcome back everybody. Quick reminder I hope you had a great discussion in your groups, and a reminder to those who were the note takers within your groups, if you could take just a quick minute right now and go into the chat and share a couple of highlights from your discussions into the chat box, and that will sort of prompt some discussion here. We'll share that out with the broader group. So those who were the note takers, time to type into the chat box, please. So reminder that in your groups you were discussing if older adults who are vulnerable in this pandemic should organizations exclude volunteers over a certain age, and some comments related to that. So asking you if you were the note takers within your groups. There seem to have been lots of groups for discussion out there. If you could add a couple of comments into the chat box. There we go. There we go. Okay, here's one group who is letting us know that one member had age restrictions under 18 and over 60. All others did not have age restrictions at this point. Some have volunteers signing waivers before they come back, acknowledging that they understand the risks. In another group, they were discussed working with legal team to develop additional waivers addressing risks. In another group, we had vulnerable persons should be able to make their own choices as long as they are well informed, feeling that this is a form of ageism. Organizations should provide volunteers with the tools and resources they need to make informed decisions. And volunteers should be provided with mandatory updated health and safety training. Another comment from a different group was around digital engagement of volunteers was very important. Great. Thanks. Paula, any comments on that? We have some comments around waivers and age restrictions under 18 and over 60, and a lot about informed consent, informed decisions.
And as I mentioned before our discussion, while it's great that each of us are sharing our own perspectives and perhaps what, the advice that we've been given, it's really important that everybody check with their own, jurisdiction with respect to legislation, your insurance companies, and of course, any access you have to legal counsel about these matters, because it is different across the country. And it is different depending on what kind of organization and what your mandate is.
And that is great advice. We always hear from insurance professionals and the legal profession as well, that very same advice, that while general information is one thing, you have a very specific organization. And so to check with your insurance provider and legal for the conditions that are best suited to your organization, your work, and your volunteers. Another comment coming in from the chat, general consensus was that volunteers should make their own decisions regardless of age. However, clear communication regarding personal choice, no pressure. Communication regarding government guidelines on who is at highest risk, remembering it is not just age, but other groups as well. Also, consider the region and active COVID. We're hearing a lot about that as the pandemic continues, offering virtual opportunities, ensuring good training around PPE, and offering tours regarding new conditions before making a decision. One member felt the organization should select the age. So lots to chew on there, and lots of great ideas in terms of re-engaging active volunteers in person into a space. Additional training that might be needed once they get there. It's a great comment about a physical walkthrough, because your environment will be physically changed. Sometimes there are barriers that are put up or different ways of doing things. So a volunteer who may have made a decision about wanting to return may feel reconfirmed or may change their mind, just depending on what the physical location looks like once they get there. That is true. Communication in all things will be important. One of the other things, Paula, we're hearing a lot about and seeing across the country is that different regions have different levels of activity related to the virus, and that the opening and closing and the restrictions imposed by government are different in different regions of the country too, and that may influence organizations.
Absolutely, and I think that one thing that we've learned, regardless of legal advice and insurance, what your insurance will cover, that ultimately you need to be following public health directives. And so while it is discriminatory to ask people of a certain age not to volunteer, if it has been directed by public health, then it is often considered to be a legitimate form of discrimination if, in fact, there has been a clear directive in your jurisdiction about age and staying home. So all of those things need to be taken into account.
Super. Lots of great ideas on this question. So I think we will leave it there, and maybe time to go to the second discussion question. Is that okay, Paula?
Mm-hmm.
There you go.
Okay. So another issue that has come up a number of times in our discussions with folks is that there are people who perhaps work in healthcare or in schools or in other essential services where they have lots of exposure to potential people who are potentially infected. And therefore, the organizations are wondering, are they able to ask those folks who they consider to be higher risk not to volunteer to protect their clients and their staff? And again, is this type of discrimination bona fide? And should people be able to continue to volunteer as long as they believe they're taking proper precautions? Whose decision is that? So it's another angle of the question we were talking about in terms of our decisions to protect people as organizations, safety, and being inclusive of people who want to volunteer and respectful of their right to make decisions on their own. So that's the second scenario that we thought was a good one for, again, kickstarting your group discussions.
Okay, so I'm going to start with some of the comments that we're hearing back within the group. So the first one is saying that it would depend on the agency's policy. So again, this is around healthcare professionals and those providing essential services, and then coming to organizations to volunteer. For example, if it's a healthcare facility, there may be restrictions on only volunteering or working at one site if they are a healthcare worker. Otherwise, it would be discrimination. Volunteers follow the directives of public health and follow the self-screening tools that do not ask questions about what type of work or location of work. That's a really good comment that we have heard. Again, I think, Paula, you were commenting even where this question came from when it came to us about working in different settings in healthcare. Another comment, it has not been an issue or question for most of us, but we agreed that essential workers are well informed and aware of precautions. So if they are willing to follow procedures, then it would be fine. Also, in long-term care staff, were given the directive to only work in one facility, and volunteers were asked only to engage with one facility as well. That seems to be a consistent message that we're getting. We're hearing that across the country, government directives from regarding workers, employees in long-term care working in only one facility. So this is now we're hearing crossing over with volunteers as well, as they are coming back and working with organizations in order to limit the exposure across facilities. Our group, unfortunately, has mic issues. The question topic is a difficult one to assess based on how best to mitigate risk. Consensus that it is discrimination to exclude healthcare workers and essential service workers. Everyone should be treated equally. In a hospice setting, some places have restricted volunteers to one location or limited participation. Also felt essential workers may be burning out and may not want to return at this time. And that, I think, is a very fair comment that many of us have concerns about. None of us had the experience of having an essential worker wanting to volunteer with us. One person suggested that their employers may ask essential workers to avoid excess contact outside work. If a volunteer were to say they were volunteering at a hospital, then we may ask them to choose between the two opportunities, mainly for the safety of the staff and volunteers. We may want to offer essential workers off-site or virtual opportunities. People who are healthcare providers or other essential workers likely aren't as interested in volunteering currently because they are very busy. One person in our group said their organization was transparent with volunteers when another volunteer was a healthcare professional. This way, the volunteers can decide whether they are comfortable volunteering with other high-risk people. Very good point. Reinforcing the importance through all of this of clear and consistent communication at all levels. None of our group members had really considered this before. Some members spoke of volunteers being required to fill out an online screening form before coming to volunteer for the shift, and the form asked questions about symptoms, travel exposure, etc. The form didn't ask if they were a healthcare worker or frontline worker. In one hospital, they were aware that some volunteers work at other hospitals. They do see an increased risk, so asked volunteers to self-disclose that they volunteered in other healthcare settings based on what they've offered the role if it does not involve direct contact with patients. So we're hearing a lot of that consistency, Paul, I think, about trying to limit exposure and risk by asking volunteers to limit the number of places where they're volunteering, especially if they're essential or healthcare worker.
Yes, and I think, again, some of these issues that you've been discussing or questions that have been posed are things that are suitable for discussions with your boards, with your insurance companies, and with any other kind of legal advice or legislative body, because it is the first time we're considering many of these issues. And while safety is first, we also want to make sure that that the decisions we make to mitigate risk are also fair and reasonable. And I think that that's something that's important to all of us. So these questions here, while they seem maybe jarring, again, this is what we're hearing and is being asked by organizations. So if a client is infected by a volunteer, if a volunteer is exposed and is infected by carrying out their volunteer role, what is our responsibility? And I think from many of our discussions with organizations, it really stems from we want to do what we can to avoid, whether it's not only protecting ourselves legally, it's not only protecting ourselves from a risk mitigation point of view in a legal sense, it's really wanting to do the right thing. And I think that's where many people land, being as careful as we can, being as informed as we can. People mentioned issues of transparency, and you know, these questions we need to be asking, even though they're harsh, but we do need to be asking them.
So thank you all for your input on these questions. Part of what we're doing at Volunteer Canada with these kinds of learning opportunities is to be able to share what we're hearing from organizations around issues and challenges that you're having, then to be able to develop resources to be able to support you, but also to provide an opportunity for you as organizations to share with each other. What are some of the questions and concerns that you're hearing, and how is your organization dealing with them, and the opportunity to hear from others about how that is happening. So I hope that this session today was useful in that sense. We did get a lot of comments, great comments, and we've been asked in the chat, would we be able to share that back in some kind of a summary with participants after the call? So we will take a look at that. Know that the presentation today and the recording will be available on our website. Check out our COVID-19 resources page there. You'll find a bunch of resources and learning opportunities and recordings of sessions like this one. I mentioned earlier that we have our fall survey out in the field, and we would invite you please to share your opinion and help us better understand the challenges that you're facing through that survey. There's a link on our website to be able to find that and share with others, not just organizations, but volunteers as well. In the last survey that we had, more than 600 volunteers across the country, for example, shared their volunteer experience during COVID. As I mentioned, we have upcoming learning opportunities on the go all the time. The next set that you will see is around shifts in volunteering. On October 27th, that webinar will be in French, and on the 29th, that webinar will be in English. If you have any questions or comments, please feel free to get in touch with us. More than happy to stay in touch with you. Thank you to Paula for leading us through our discussions today, and for all of you for contributing so much to these discussions. We appreciate you taking this hour out of your day to join us and to join each other. Thanks so much. Enjoy the rest of your day. Paula, thank you very much. And we will see you, we hope, next time at our webinars coming up at the end of October. Thanks, everybody.